Secrets of examination. The basic problem which our students face during their studies and examinations is lack of guidance. That is the reason why, despite having sound knowledge about the subject, they fail to gain a good score. Here are some tips to remember to improve your scoring in your final year examinations. Pattern of study. The pattern of study at the undergraduate level is quite different from that of postgraduate level. At the undergraduate level, importance is given to the diseases that are common in our region, while at the postgraduate level, thorough knowledge of the subject is required. So you should have comprehensive knowledge of the diseases for final year examination that are common in our part of the world. Moreover, examiner does not expect that you can reach the correct diagnosis. He just wants to see your method that you adopt to reach the diagnosis. For example, first of all, make differential diagnosis, then according to age, sex and race of the patient, risk factors, proper history and examination rule out the irrelevant diagnosis and give one or two most probable diagnoses. Then he will ask the methods to confirm the diagnosis. That is, he wants to ask relevant laboratory tests. Following are the modalities of your examination. There will be one long case, there will be two short cases, and there will be table viva, in which instruments, pathology specimens, X-rays, drugs, and general discussion are included. Long case. There will be one long case allotted to each student. List of the important long cases is given below. Prepare these cases as thoroughly as possible. It would be better if you take a round of your medical ward before the examination to have a look at the cases present there. Try to study the patients. This will prove a great help to you. While preparing for the long case, you are also supposed to know the differential diagnosis of the complaints related to the case. Say for example, you get a case of peptic ulcer. In addition to the causes, signs and symptoms of the disease, you should also know other conditions that can mimic the disease and can produce similar symptoms. Sometimes, the panel of examiners compromises examiners from other specialties of the medicine, for example neurology, chest medicine, etc. They put special emphasis on history taking and judge the student on the basis of this history taking. Remember a golden rule that good history can score you good marks. So try to take a good history of your case. Do not read the history to the examiner. Try to recite it. It will give a good impression. Write your diagnosis regardless of being right or wrong, but you should be able to defend your diagnosis. When the examiner asks you about your diagnosis, do not tell him the diagnosis straight away. Rather say, on the basis of history and examination, my diagnosis is XYZ. Then the examiner will ask you about your history and findings on examination. Always tell the examiner the positive findings of your general examination first. For example, the patient looks anemic, he has cervical lymphadenopathy, rest of the general physical examination is normal. First describe the patient's vital signs, that is pulse, BP, temperature and respiration. Be careful to choose the right words and right statements while presenting your case. Now we came on the systemic examination. While writing about the systemic examination, write the system first, which according to the patient's complaint seems to be involved most. For example, if patient presents with pain in epigastrium, hematemesis, abdominal distension, gastrointestinal tract involvement seems to be most possible, so you should do a thorough GIT examination with inspection, palpation, percussion and auscultation. Other systems should be described briefly. Now important long cases. For gastroenterology, peptic ulcer, malabsorption, abdominal tuberculosis. In liver, acute viral hepatitis, that is jaundice, cirrhosis, obstructive jaundice, hepatoma, liver abscess. For respiratory system, tuberculosis, COPD, asthma, bronchiectasis, pneumonia, and bronchial carcinoma. In cardiovascular system, cardiac failure, valvular stenosis or regurgitation. In endocrinology, diabetes mellitus, hypothyroidism, hyperthyroidism, obesity, and Cushing's syndrome. From rheumatology, rheumatoid arthritis, SLE, septic arthritis. From kidney, chronic renal failure, nephrotic syndrome. From CNS, stroke, cranial nerve palsies, meningitis. From hematology, anemia and leukemia. From infectious diseases, typhoid, malaria, dysentery, food poisoning, amoebic dysentery, filariasis. Now short cases. There will be 2 short cases allotted to each student. List of the important short cases is given below. Prepare them thoroughly. General physical examination, examination of GIT, examination of respiratory system, examination of CVS, examination of motor system and cranial nerves. Now general physical examination. The patients may be having any of the following features and the viva will be based on the findings of the patient. Anemia. Causes of anemia, especially iron deficiency anemia. Clubbing. Causes especially bronchogenic carcinoma and TB. Purpose. Causes of thrombocytopenia and other coagulation disorders. Jaundice, pigmentation. Now examination of GIT. Clinical methods of palpation of liver, spleen and kidney. Percussion of abdomen. Fluid thrill and shifting and related discussion. Examination of respiratory system. Mostly the cases are of COPD, TB and pleural effusion and the students are asked to percuss and auscultate the chest. Examination of CVS. Students may be asked to examine the JVP, palpate the peripheral pulses, auscultate any murmur or additional sound. Mostly the cases are of mitral stenosis and regurgitation. Examination of motor system. Usually the case is of upper motor neuron lesions. Procedure of eliciting reflex and of checking tone is examined. Cranial nerves. Usually procedures of oculometer and facial nerves test are examined. Now table viva. Instruments. Table viva is usually started with instruments, therefore they should be prepared thoroughly. Instruments should be studied under their modalities, their indications, contraindications and complications. Examiners usually ask the student to pick any instrument and then the viva proceeds with the discussion related to the instrument. For example, if the student is asked to pick the LP needle, then the questions related to meningitis may also be asked. So prepare all the instruments thoroughly. Pathology specimen. Mostly the specimens are liver, spleen, ascaris and tinea. Drugs. Indications of drugs and side effects of drugs. X-rays. Common X-rays are pleural effusion, TB, cardiomegaly, bronchogenic carcinoma. Now psychological aspects of the examination. Stop all your studies at 11 p.m. a night before the examination. Relax yourself and try to have a sound sleep. If you are anxious and could not sleep, then take a type Dormicum or Xanax. These are rapid sleep inducers and have no hangover next day. On waking, you will feel fresh and alert next morning. You must enter the examination hall with fresh mind. Your dress should be neat and clean. Shoes should be polished and hair should be properly combed. Don't forget to bring with you your stethoscope, torch, hammer, measuring tape, pen, and neat and clean white coat. How to approach the examiner. When your number is called, first say the greetings to the examiner, then ask the permission to sit down. Try to answer all the questions with confidence. If you don't know the answer, tell the examiner you don't know. He may then move to another question. Never try to provoke the examiner during the examination. Try to remain calm. Listen every question carefully and take your time to answer it. If you follow these steps, I am confident that you will improve your scoring a lot. Wish you all the best. Thank you.